Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the pharmacology of the benzodiazepine. The benzodiazepines are sedative, hypnotic drug. It induces sleep and relaxation. Classification according to the half-life, short acting. Half-life is around 5 hours or less. This includes midazolam, triazolam. Intermediate acting benzodiazepine, half-life 5 to 24 hours. These intermediate acting benzodiazepines include alprazolam, lorazepam, clonazepam, oxazepam, temazepam. Long-acting benzodiazepine half-life is more than 24 hours. This includes chlordiazepoxide, chlorgepate, diazepam, flurazepam, and perazepam. Okay, one important point is that we'll get a lot of PAM, PAM, and GPAM, with some exception, like chlorgepate, okay, chlordiazepoxide. So, what is the mode of action of benzodiazepine? Benzodiazepine facilitates gamma aminobutyric acid mediated inhibition of neuronal activity. This is an inhibitory neurotransmitter, and this work especially in the limbic system and in the cerebral cortex. Limbic system of the brain include multiple structure like that of singular gyrus, the mammillary body, and the hypothalamus, and cerebral cortex, the outer part of the brain. Benzodiazepine allosterically increases GABA affinity and the frequency of GABA stimulated chloride channel opening, chloride conductance, and neuronal hyperpolarization. Benzodiazepine inhibits depolarization by excitatory neurotransmitters. So these are the mode of action. So facilitates GABA mediated inhibition and also cause hyperpolarization due to increases GABA affinity and the frequency of GABA stimulated chloride channel opening, chloride conductance, and neuronal hyperpolarization. Therapeutic uses. There are many therapeutic uses for generalized anxiety disorder, agitation, delirium, and psychosis. Situational anxiety, especially some people are they become maybe anxious in certain situation. Okay, panic disorder and agoraphobia, that is also another type of anxiety disorder when a person in a place where escape is very minimum, the person cannot go out of that gathering of other people, that is called agoraphobia. Hypertension, it is found that benzodiazepine relaxes the muscle and it decreases blood pressure, especially person who has a lot of anxiety. It is a treatment for insomnia to a certain extent because it induces sleep and relaxation. Dyskinesia and seizure, therapeutic uses also for dyskinesia, abnormal movement, and convulsion is a treatment. It is also a drug of choice for the status epilepticus in severe acute epilepsy. Then it can be injected, okay, like Other drug like that of phenytoin diazepam may also be used. Pre-anesthetic and intraoperative medication, benzodiazepine is useful. It is a muscle relaxant. It is a drug for the management of alcohol or barbiturate withdrawal syndrome. Adverse effects of benzodiazepine: it causes daytime drowsiness and ataxia, so person should not drive a car if he take the medication at the night time for sleep. Daytime he should have, or he might have, drowsiness and ataxia. Rebound insomnia, that is lack of sleep on discontinuation of the benzodiazepine. Blurred vision, hypotension, tremor, that is movement, tremor, okay, constipation, hard stool, and antegrade amnesia, loss of forward memories, respiratory depression, and coma. This blurred vision, hypotension, tremor, constipation, antegrade amnesia are common among the elderly population. Okay, so it may cause respiratory depression if it is given in bigger doses, and coma, and there will be accumulation in the fetus because the benzodiazepine can cross the placental barrier, can go to the developing fetus. It may depress the central nervous system of the fetus. Okay. Also, it can be transmitted through the milk, so it should not be a good medication for a lactating mother because the baby will get the medication and benzodiazepine by getting the milk from the mother. Okay, so that is a precaution also. So not for the during pregnancy and even not for a lactating mom if it is possible to avoid that. Drug interaction, it enhances CNS depression, and when taken in combination with other CNS depressant or if it is taken along with alcohol. We have some note. This drug may lead to tolerance. If you take more and more this drug, then the response may be decreased. Abuse, especially person who deal with the medication, they may abuse, like hospital doctor or nurses. And dependence, okay, on this medication. Cross tolerance with other sedative hypnotic drugs, including barbiturate and alcohol, is possible. Benzodiazepine withdrawal syndrome is characterized by, so if a person is abusing benzodiazepine, if he don't get that medication, he may develop benzodiazepine withdrawal syndrome that is manifested as anxiety, insomnia, gastrointestinal disturbances, headache, and tremor. So what is the antidote for benzodiazepine? If it is taken in a big dose, we need some antidote. Antidote is the flumazenil. Okay, that is a GABA receptor inhibitor. Okay, so that is the antidote. The person is almost close to the coma or have respiratory depression, then we may add naloxone. But flumazenil is the typical antidote for benzodiazepine. Please support my channel. Please subscribe me and share the information with your friends. Have a nice, wonderful, and blessed day. Bye now.